There is a sleep position that millions of people over 60 are using every single night. A position that feels comfortable, a position that seems natural, but that position is quietly putting enormous stress on your heart, reducing oxygen to your brain, and significantly increasing your risk of a cardiovascular event while you sleep. And most people have absolutely no idea that the way they are lying down for 8 hours every night is working against every other healthy choice they are making during the day. My name is Dr. James Harlow. I have been practicing general and preventive medicine for over 20 years, and I can tell you that sleep position is one of the most overlooked factors in cardiovascular health, especially for people over the age of 60. What I am about to share with you today is something most doctors never discuss in a standard appointment because there simply is not time. But after seeing patient after patient come into my office with unexplained nighttime symptoms, after reviewing sleep studies that show clear patterns of cardiovascular stress, after having conversations with cardiologists and sleep specialists about what they are seeing in their practices, I knew I had to make this video. Let me tell you about a patient I saw just 3 weeks ago. His name was Robert, 68 years old, retired firefighter. Came to see me because he had been waking up almost every night around 3 in the morning with his heart racing. He described it as a pounding sensation in his chest that would wake him from a deep sleep. Sometimes it was accompanied by a feeling of pressure, almost like something heavy was sitting on his chest. He would have to sit up in bed and wait for his heart rate to slow down before he could fall back asleep. This had been happening for months, getting progressively worse, and he was terrified he was having heart attacks in his sleep. We ran every cardiac test I could think of: electrocardiogram, echocardiogram, stress test, 24-hour heart monitor. Everything came back normal. His heart was structurally sound. No blockages, no arrhythmias during the day. But the nighttime episodes continued, and Robert was exhausted. He was afraid to go to sleep because he did not know if he would wake up with that terrifying pounding in his chest. So I asked him a question that most doctors never think to ask. I asked him to describe exactly how he sleeps. What position does he fall asleep in? Does he move during the night? Does he use pillows? And Robert told me something that immediately explained everything. He said he sleeps flat on his back, completely flat, no pillow under his head, arms at his sides perfectly straight. He had been sleeping this way for over 40 years. He said it was how he learned to sleep in the military and he never changed the habit. And that was it. That was the problem. Robert's sleep position, the position he thought was neutral and harmless, was causing his nighttime cardiac symptoms. And once we changed how he slept, once we adjusted his position and added proper support, the episode stopped completely within a week. Now let me explain why sleeping flat on your back, especially as you age past 50 and 60, is so problematic for your cardiovascular system. And I want you to pay very close attention to this because the physiology is something that most people, even most healthcare providers, do not fully understand. When you lie completely flat on your back, with no elevation, several things happen simultaneously in your body. First, gravity no longer helps your circulatory system the way it does when you are upright or even slightly inclined. When you stand or sit, gravity helps pull blood down from your head and upper body back towards your heart. But when you lie flat, your heart has to work harder to maintain proper circulation. Blood pools more easily in certain areas. The pressure dynamics throughout your vascular system change dramatically. Second, and this is critical, when you lie flat on your back, the soft tissues in your throat and airway are more likely to collapse backward. This is especially true for people over 60 because as we age, the muscles in our throat and neck lose tone. They become weaker. They do not hold their position as well. So when you lie flat, your tongue falls back slightly, the soft palate relaxes, and your airway narrows. This causes what we call increased airway resistance. You are not getting as much oxygen with each breath as you should be. Now, if you are wondering if you have been sleeping in this position and experiencing these issues, if this is resonating with you right now, I want you to write the word changing in the comments. And if this is the first time you are hearing that sleep position can affect your heart health, write learning below. I read every comment, and I want to know how many people are experiencing this so I can make more videos addressing what you actually need. And while you're down there, please make sure you are subscribed to this channel and that you have liked this video, because this information could genuinely save lives and it only reaches more people if you help me spread it. Let me continue explaining what happens to your cardiovascular system when you sleep flat on your back. That narrowing of your airway, that increased resistance to breathing, means that your blood oxygen levels drop during the night. Not enough to wake you up necessarily, not enough to cause obvious symptoms, but enough to stress your heart. When your oxygen levels drop even slightly, Your heart has to beat faster and work harder to deliver adequate oxygen to your tissues. This is called a compensatory tachycardia. Your heart is compensating for the reduced oxygen by increasing its rate. But there is more. When your airway is partially obstructed, when you are not breathing as efficiently as you should be, the negative pressure in your chest increases with every breath. You are working harder to pull air into your lungs. This negative pressure affects your heart directly. It changes the pressure gradients in your chest cavity. It makes it harder for your heart to fill with blood between beats. It increases the workload on your heart muscle. And if you are doing this for 8 hours every single night, if your heart is under this kind of stress for a third of your life, the cumulative effect is enormous. Now, many of you are probably thinking about sleep apnea right now, and you are right to make that connection. Sleep apnea, particularly obstructive sleep apnea, is incredibly common in people over 60. It affects more than half of men over 65 and a significant percentage of women in that age group as well. And sleeping flat on your back makes sleep apnea dramatically worse. In fact, many people who have mild sleep apnea when sleeping on their side will have moderate to severe sleep apnea when sleeping on their back. The position matters that much. Sleep apnea means that your breathing actually stops, completely stops, multiple times during the night, sometimes dozens of times per hour. Each time your breathing stops, your oxygen levels plummet, your heart rate spikes, your blood pressure surges, your brain partially wakes up to restart your breathing. And this cycle repeats over and over throughout the night. The cardiovascular stress is incredible. Sleep apnea dramatically increases your risk of heart attack, stroke, heart failure, and sudden cardiac death. And sleeping flat on your back makes all of it worse. I had a patient, a woman in her early 70s named Dorothy, who came to see me complaining of severe daytime fatigue and morning headaches. She said she was sleeping 8 to 9 hours every night, but waking up feeling like she had not slept at all. Her husband mentioned that she snored loudly and that sometimes it sounded like she stopped breathing for a few seconds before gasping and starting again. Classic signs of sleep apnea. We sent her for a sleep study and the results were shocking. She was having 67 apnea events per hour. Her oxygen saturation was dropping into the low 80s, sometimes even the 70s. Normal oxygen saturation should be above 95%. But here is what was remarkable. When the sleep technician had Dorothy sleep on her side instead of her back, during the second half of the study, her apnea events dropped to 12 per hour. Still not perfect, but a dramatic improvement just from changing position. Her oxygen level stayed much more stable. The strain on her cardiovascular system was significantly reduced. Dorothy ended up getting a CPAP machine to treat her sleep apnea, but she also committed to never sleeping flat on her back again. And within a month, she told me she felt like a different person. Her energy was back. The headaches were gone. She felt rested for the first time in years. But even if you do not have diagnosed sleep apnea, even if you have never been tested, sleeping flat on your back still affects your cardiovascular system in ways that accumulate over time. Let me explain another mechanism that most people are not aware of. When you lie flat, the blood volume in your chest increases. Blood that would normally pool in your legs when you were standing redistributes when you lie down. More blood returns to your heart. This is called increased venous return. For a young, healthy heart, this is no problem. The heart handles the increased volume easily. But for an aging heart, for a heart that might already be dealing with stiffness, reduced pumping efficiency, or early heart failure that has not been diagnosed yet, this increased volume puts strain on the system. Your heart has to pump harder to move that extra blood volume. The pressure inside your heart chambers increases. Over time, this can contribute to the stretching and enlargement of the heart muscle, particularly the left atrium and left ventricle. An enlarged heart does not pump as efficiently. It is more prone to developing irregular rhythms, what we call arrhythmias. And irregular heart rhythms in older adults significantly increase the risk of stroke because blood can pool in the enlarged chambers and form clots that can travel to the brain. Now let me talk about another issue that is directly related to sleeping flat on your back, and that is acid reflux. When you lie completely flat, there is no gravity helping to keep stomach acid where it belongs. Stomach acid can flow backward up your esophagus much more easily. This causes heartburn and that burning sensation in your chest. But here's what most people do not realize. Acid reflux does not just cause discomfort, it can directly affect your heart. The esophagus and the heart are very close to each other anatomically. They share some of the same nerve pathways. When acid irritates your esophagus, it can trigger what we call referred pain to your heart. People experience chest pain, pressure, even palpitations, and they think they are having a heart attack when it is actually severe reflux. But beyond the referred pain, chronic acid reflux causes inflammation in your esophagus, and that inflammation can irritate the vagus nerve, which directly affects your heart rate and rhythm. I have seen patients develop atrial fibrillation, an irregular and often rapid heart rhythm that was triggered by chronic acid reflux made worse by sleeping flat on their backs. I treated a man last year, a gentleman in his mid-60s named Harold, who had been experiencing episodes of rapid heartbeat at night. His heart would suddenly start racing at 140, 150 beats per minute, waking him from sleep in a panic. He had been to the emergency room twice. Both times, by the time he got there, his heart rate had returned to normal. They could not find anything wrong. We put him on a heart monitor at home, and we captured one of these episodes. It was atrial fibrillation, but what we also noticed was that every single episode happened within an hour of him lying down to sleep. When I dug deeper into Harold's habits, he told me he would eat dinner late, around 8 or 9 at night, often heavy meals, and then go to bed around 10:30 or 11. He would lie flat on his back to sleep. What was happening was that lying flat immediately after eating was causing severe acid reflux. The acid was irritating his esophagus and vagus nerve, and that irritation was triggering the atrial fibrillation. Once we changed his eating schedule, elevated the head of his bed, and had him sleep on his left side instead of his back, the episode stopped completely. No medication needed, just positional changes. Now let me address something important. Some of you might be wondering, is sleeping on my back ever okay? And the answer is that it depends on several factors. If you are young, if you are healthy, if you have no cardiovascular issues, no sleep apnea, no reflux, then sleeping on your back with proper support might be fine. But after the age of 60, especially if you have any risk factors for heart disease, high blood pressure, diabetes, obesity, a history of smoking, or a family history of cardiovascular problems, sleeping flat on your back is simply not worth the risk. The safest sleep position for your heart and your overall cardiovascular health is sleeping on your left side with proper pillow support. And let me explain why this position is optimal. When you sleep on your left side, gravity helps your heart pump more efficiently. The aorta, which is the large artery that carries blood from your heart to the rest of your body, curves to the left. When you lie on your left side, blood flows more easily through the aorta because gravity is working with your heart instead of against it. This reduces the workload on your heart muscle. Sleeping on your left side also keeps your airway more open. Your tongue and soft palate are less likely to fall backward and obstruct your breathing. This means better oxygen levels throughout the night, less stress on your heart, better sleep quality overall. And for people with acid reflux, the left side position actually helps keep stomach acid in your stomach because of the way your stomach is positioned in your abdomen. The entrance to your stomach is on the right side. When you sleep on your left, gravity helps keep that entrance elevated above the acid level, preventing reflux. Now, some people find it uncomfortable to sleep on their side, especially if they have shoulder pain, hip pain, or arthritis. And I understand that. But there are ways to make side sleeping more comfortable. Use a good quality pillow that supports your head and keeps your neck aligned with your spine. Place a pillow between your knees to keep your hips aligned and reduce pressure on your lower back. If your shoulder hurts, try a softer mattress or a mattress topper that allows your shoulder to sink in slightly. The key is to find a position that is both comfortable and cardiovascularly safe. And if you absolutely cannot sleep on your side, if you have medical reasons that prevent it, then at minimum, you need to elevate the head of your bed. Not just use more pillows, but actually elevate the entire head of your bed by 6 to 8 inches. You can do this with bed risers or by placing blocks under the legs at the head of your bed. This elevation helps with circulation, reduces the risk of reflux, and decreases airway collapse. It is not as good as side sleeping, but it is significantly better than lying completely flat. Let me share one more patient story because this one really illustrates the power of changing your sleep position. I had a patient, a retired nurse in her late 60s named Susan, who had been experiencing chest pain at night for over a year. She described it as a tightness, almost like a band around her chest that would wake her up 2 or 3 times a week. She was convinced she was developing heart disease. Her mother had died of a heart attack at 72, so Susan was understandably terrified. We ran extensive cardiac testing. Everything was normal. No blockages, good heart function, normal rhythm. But Susan's symptoms continued. She was losing sleep from worry. She was afraid to exercise because she thought it might trigger a heart attack. Her quality of life was declining rapidly, so I asked her about her sleep habits in detail. She told me she slept flat on her back, always had, and she noticed the chest pain always happened when she was lying in bed. Sometimes it would wake her from sleep. Sometimes it would happen just as she was falling asleep. Based on that timing and the description of the pain, I suspected it was actually severe reflux, not heart disease. We had her elevate the head of her bed and change to sleeping on her left side. Within 2 weeks, the chest pain was gone. Completely gone. She could not believe it. Susan cried in my office when she came back for her follow-up. She said she had spent a year thinking she was dying, a year afraid to live her life, and the solution was as simple as changing how she slept. She was angry that no one had asked about her sleep position sooner. She was relieved that she was not sick, and she was grateful that she now had her life back. That conversation reminded me why I do this work, why I make these videos. Because simple information that takes 5 minutes to explain, can completely transform someone's health and quality of life. So, what do I want you to do with this information right now? First, I want you to honestly assess how you sleep. Tonight, pay attention to what position you naturally fall into. If you sleep on your back, I want you to make a conscious effort to change. Start sleeping on your left side. Use pillows to support yourself and keep yourself from rolling onto your back during the night. It might feel awkward for the first few nights. You might wake up and find yourself on your back again. That is normal. It takes time to change a deeply ingrained habit. But keep at it. Your cardiovascular system will thank you. Second, if you have any nighttime symptoms, if you wake up with your heart racing, if you have chest pressure or pain at night, if you feel short of breath when lying down, if you snore loudly or your partner says you stop breathing during sleep, if you wake up with headaches or feel exhausted despite sleeping enough hours, please talk to your doctor. These are warning signs. Your body is trying to tell you something. Do not ignore it. And specifically mention your sleep position and ask whether changing it might help. Third, if you have not had your cardiovascular health checked recently, if you are over 60 and it has been more than a year since you had blood work, blood pressure monitoring, and a discussion about your heart health, schedule an appointment. Prevention is always easier than treatment. Catching problems early before they become serious can save your life. And fourth, share this information with people you love. If your spouse sleeps flat on their back, if your parents do, if your friends do, tell them what you learned in this video. Send them this video. It could make a real difference in their health and longevity. Now here is what I need from you before you go. I need you to like this video right now. I need you to subscribe to this channel because I make videos like this every single week. Videos about the health information that actually matters to people over 50 and 60. Information your doctor does not have time to explain in a 15-minute appointment. And I need you to leave me a comment. Tell me how you sleep. Tell me if you're going to change your position. Tell me what other health topics you want me to cover. Your feedback directly shapes the content I create, and I genuinely read and respond to as many comments as I can. I truly hope this information helps you take better care of yourself and the people you love. Protecting your heart health is not about fear. It is about understanding how your body works, recognizing what helps and what hurts, and making small, simple changes that add up to a longer, healthier, more vibrant life. You deserve to sleep well. You deserve to wake up feeling rested and energized. You deserve to protect your heart. And sometimes all it takes is changing the position you sleep in. Take care of yourself. Pay attention to what your body is telling you. And I will see you in the next video.